to Real People, Real Matters. This is Diana Tulchinsky with my first guest, Dr. Dean Cherniak. Dr. Dean, please tell us about when did you get started in the sciences, like in the primary years?
When I was younger, I grew up in the far northwest suburbs, and back in the 70s and 80s, which I grew up in, there was a lot of land, a lot of fields to run around, and I also grew up on a lake. So I had a lot of opportunity to go explore, and we went fishing, we went looking for frogs, turtles, and all that. And I always got interested. I was always interested in why something worked, or why this happened, or why that happened. So I was always looking for reasons why things occurred. So just walking through the streams and looking at different from animals to plants to anything like that. And then anything that I learned in grade school. I just said, I want to know more about it, so I went into the backwoods or the streams and kind of investigated for myself.
What about in the junior high and high school years? Were your parents encouraging you, or your teachers encouraging you to go into the health sciences?
No, it was basically something that I just, like I said, grew up enjoying. One thing I think that really got me interested in sciences is that I wore glasses when I was in 5th grade. And I remember the optician or the optometrist always saying, "Oh, he has a lazy eye, he has a lazy eye." Well, I wasn't satisfied. Well, why do I have a lazy eye? So I started reading a book on how the eye works. And so just kind of went with that, wrote a paper on it, and then it kind of stemmed into other things. And I was the kid back then that had the microscope and the chemistry set, and I would take my microscope, I would go get a fish scale, put it underneath it, look underneath that. So I was always curious on what things looked like up close.
Where did you go for undergraduate?
I went to the University of Wisconsin in Green Bay. I went in and did human biology with a health science emphasis, and I had a minor in chemistry.
And when did you change your major concentration from pre-med to chiropractic, or what stirred you that way?
Well, when I was in undergrad, I was on the pre-med platform, or went that way, and kind of halfway through school, I got involved with a doctor or a professor I took some genetic courses, and just the DNA, the RNA, and how it was transcribed, and the different it just fascinated me. So I wanted to learn, how things were and how they function, and back, going through and learning all the lab stuff with culturing fruit flies, and why one had red eyes, why it had black eyes, why did one have long wings, short wings, crinkled rings. So we grew them up, and we looked at them under the microscope, and we were following how genetics was passed on from generation to generation. So after graduation, I went to the University of Iowa, where I studied to be just focused on genetics. And it got me into cytogenetics, which is the study of genetics at a chromosome level. So we were actually diagnosing and looking at conditions based on how the chromosomes were lined up, or if they were missing, or if there was too many of them, or were they switching positions. Okay, that led to where I went from the University of Iowa. After I got into cytogenetics, I went to the Medical College of Wisconsin and worked in pathology, helping people with cancer or birth disorders or anything like that. So that's a lot of things that you can look at on the chromosomal level, where if someone had leukemia, there are certain leukemias that have a different karyotype, where the chromosomes line up differently and they're banded differently. Same with like Down syndrome. So Down syndrome has too many of one chromosome 21.
Oh, okay. And cerebral palsy has the lack of...
Cerebral palsy is not so much a genetic condition as it's loss of oxygen during the birth process.
Oh, okay. And what made you go into chiropractic here?
Well, I was already working as a cytogenetic technologist at the Medical College of Wisconsin, and ever since I was about 8th grade. So I grew up, I was in 3 sports. I was in football, I was in basketball, and baseball. So I always was active, and by the time I was in 8th grade, I started working out because I was moving from youth football to high school football, and I wanted to work out. So I started working out about 8th grade. So I had been working out from 8th grade till about the age of, 30 or so. So in my mid-20s, about 23, 24, I was at the gym and I injured myself working out. Basically, my spotter pulled the spot bars or the safety bars out of the squat rack too soon, and the bar fell on me.
Oh, wow.
So because I worked at a position where I sat all day, my simple lower back pain that I thought would just go away on its own, after 3 weeks became numbness and tingling in my foot.
Oh, that's
So
awful.
the ironic thing was that the guy I was working out with, his brother-in-law was a chiropractor in town.
Oh, so
And
that
he
was
told
your
me
role model.
he told me to go in right away. I didn't listen to him. So after 3 weeks and numbness tingling in my leg, I finally went to him, and after going through an exam, x-rays, and having an adjustment and being told what was wrong, it was like my first adjustment. I was just like, oh my gosh, the pain just completely released from my lower back. I still had some leg pain, but after a course of a couple months, I went back. I asked him, where'd you go to school? And so that was like a pivotal shift in my whole realm of focus. I'm like, wow, I got to get into this.
Oh, your success story of how
Right.
you changed.
Right, and it was such a pivotal point in where I was, and I was like, wow, helping someone out with, and I was never really, take, Tylenol or anything like that for pain because I worked out. I just figured, if I worked out some more, maybe rested a little bit, it'd get better, but it got worse. So I wasn't one to always, pop a pill and move on.
Oh, yeah. Tell me, what is this? Is this a spine or what is this?
So this is the spine, a model of a spine, and it's an area of, this is one continuous system which contains all the vertebrae, and there's 24 vertebrae from the neck all the way down to the lower back. And you got your sacrum and your tailbone, or coccyx. There's 24 vertebrae, and then there's 33 pairs of spinal nerves that go from the neck all the way down to the lower back. And all these nerves go to every part in your body. So anywhere on your skin, you'll be touching a nerve ending.
Is this the atlas or the axis?
So this is the first cervical vertebrae is C1. This is the atlas, and this is the axis. So the head and first cervical vertebrae, the atlas, articulate with each other, and then each bone below that articulate with all the rest.
How many curves are in a normal spine?
From the side view, there's 3 curves. The 2 normal ones, one in the neck and one in the lower back, is called lordosis. The curve from the back of the spine, or in the mid-back of the spine, is called the kyphosis. Okay? And so there are 3 normal curves that you want to maintain as much as you can throughout life. And the spine should be as straight as possible, as well as the hips, to allow normal nerve function and joint function.
And what is the physiology behind the alignment in chiropractic care?
Well, the physiology, the focus of chiropractic is to maintain spinal motion as well as nerve function as well.
And how does blood pressure and immunity and the cardiac output, how does that become affected when the spine's not aligned or it becomes adjusted right away?
Okay. Well, what happens is that the things that you're talking about are specific conditions that can occur over time.
Over time.
Over time, right. What you're looking at is, what a chiropractor focuses on is something called a subluxation complex. And there's 5 components of that complex. First, there's joint restriction or hypomobility, where the joint becomes stuck or fixed or locked in position. What that does is that sets up another condition of 4 different things, where there's localized swelling and inflammation, okay, in the joint that's stuck. When that joint becomes stuck in that motion or out of alignment, the vertebrae above and below have to take on that extra stress.
Oh, okay. And so when you carry the weight in your head, is that a reason for migraines, or when it's not adjusted properly, or is it focused too outward?
A lot of times a lot of the symptoms occur because of abnormal structure or position of the spine, segmentally as well as globally. So if you're talking about like head forward carriage
Yes.
is where the head is far past the shoulders. The head typically weighs anywhere in an average person 10 to 12 pounds.
Oh.
But for each inch that your head falls past the shoulders, you add another 10 pounds. So if you see most people walking with their head out over their shoulders, they could be carrying a 30, 40-pound bowling ball.
Oh, wow.
And so what
That's
happens
a
is
lot of
that
weight.
when your head falls forward, that normal cervical curve becomes straight. So there's stress through the joints, ligaments and tendons, as well as irritation of the nerves from the cervical spine.
And what happens in fibromyalgia and Parkinson's or in MS? Can you affect that condition?
So what we do is that chiropractic doesn't cure anything. We just help manage the function of the nervous system. Since the nervous system is the master system, it controls every other system, okay? So what a chiropractor's job is to do is to find those joints that are not moving properly. And because of that, like I said, you'll have the pain, the swelling, but you'll also have some nerve irritation, some compression. The nerve gets compressed more likely when the disc is bulging, okay? You could still have restriction of the spine, and the other three components is either muscle spasm, muscle weakness, or atrophy. But then prolonged hypomobility or fixed joints can also result in muscles that become either spasmed or degenerative. Okay, now the degeneration in the muscle can be anything like comparing a good juicy steak to one that has a lot of gristle. Gristle is the fibrosis or degeneration of the muscle. Prolonged hypomobility also increases the degeneration within the joint itself, all right, so the facet joints, as well as in the disc here. These are spacers, but also shock absorbers. And the most important thing, if something is locked out of position like that, those discs are hydrophilic. They love water. They're filled with water. If a disc is out of alignment and not moving properly, that water can't get back into the disc unless you move it.
Oh, okay. So you do help the quality of life with neurological.
Right. So it's not only, you're not only affecting nerve function, you're affecting joint and disc function as well as muscular components. So all the joints, when we adjust someone, we're helping those other four components by getting that joint moving again.
Joint mobility.
The joint mobility is the most important because those four things are the result of restricted motion in a joint.
And tell me, what type of endorphins are released when you do an alignment?
So the endorphins, there's many endorphins that kind of, when you make an adjustment, the pain is, reduced here as well as in other areas of the spine. So if you have neck pain and, you have some lower back pain, and if we adjust the neck, you could still affect the lower back.
Please tell me about the mind-body connection.
All right, so I want to use a real quick analogy, and the analogy is that the spine is to the brain as the cell tower is to your phone. So how many times that you have been sending a text message or talking on the phone and then you have a dropped call?
Oh, thousands.
All right, so so what's happening is that you got messages going into the cell tower, all right? Those messages need to beam back out to whoever you're connected with. Same with the body. There's tons of messages coming in that our body is constantly trying to figure out. Just think you're listening to my voice. You're trying to process that. You're listening, your head is shaking, so, your muscles activation. So that message coming in has to filter to the brain and it has to be sent back out. If the spine is locked out of position or locked in a position that you can't fully understand what's coming to the brain will try to make as much correction as possible, but this message doesn't get to you. Just like when you have a dropped cell phone. The message is coming in, so you're dialing into the cell phone, but because of weather or maybe damage to the tower, it can't get out. So you only get 2 bars versus 5.
How do you help with brain fog or ADHD in young people?
So again, the nervous system is the master system, all right? We normalize brain-body connection by making the adjustments. There's a bunch of sensors throughout the body, in the skin, in the muscles, and in the joints. When those receptors or those joint sensors are not functioning properly, actually the reduction of those sensors causes what is a nociceptor sensor, and that causes pain or reduced function, and then that causes a downward spiral of someone's health.
Oh, thank
So
you.
the processing centers up here are trying to, but they can't get through.
And tell me, how is the joint chiropractic care different from others? Like, you don't necessarily check insurances. It's just like a
Right. So the joint
walk-in.
chiropractic, they've been in practice, or we've been in existence for over 20 years. There's 400 clinics throughout the country. Okay. We are a cash-based practice. Okay. And we also provide memberships.
Oh,
All right, so there's a monthly, membership, just like going to the gym, but there's also other options with, per visit or packages that we offer too. So we don't accept any insurance. We don't bill insurance because our fees are lower than most deductibles and copays.
and so like, when do you give like a referral to a TENS machine or exercise? Like, when do you feel comfortable with that?
So when a typical patient comes in, a typical patient would be anybody that, threw their back out, or, someone that, because we sit at our computers all day, or our tablets, or looking at our phones, they have, strained a joint to the point where, not only if it's painful, now it's creating some maybe numbness or tingling in the arm. All right. So we'll do our exam, our consultation exam, and then we'll determine based on the exam if that person needs to be referred out. Okay. More than likely, if we're doing a complete exam that involves orthopedic and neurological exam because of the numbness and tingling in the hand, if we feel that there's weakness in the arm or the muscle strength is not where it should be, then we would more likely refer them out for an MRI. So there's local imaging centers here in Glenview and surrounding neighborhoods that we have referred to, and I have referred to quite frequently.
And with pregnant women, do you ever see them preventing a breech birth, or do you ever look?
Yes. So right now, I probably say half dozen women that are pregnant. They're in their different stages of their
Yes.
pregnancy. I do actually have a history of working with a few pregnant women that had breech, and there's a special technique called the Webster technique that actually helps flip the baby. And basically what it's doing is aligning the pelvis and allowing the ligaments within the uterus to kind of relax to allow the baby to flip and get into position and engage when they reach that 37, 38 weeks.
And do you ever work with osteoarthritis or anything like that, orthopedic, or any of the seniors, they have arthritis? And
Yeah, so we see, chiropractors see anywhere from infants to seniors. There's all age groups that we see, okay? The seniors we work with, they're working with because they have chronic conditions that have been just progressing over time, and they never really got taken care of when they were younger. They just progressively get worse, so they get to a point where they're chronic. So we could help with the daily pains that they deal with. Recently there was some studies done where that seniors that actually take and follow chiropractic maintenance care, they actually have less or fewer visits to their doctors. They're taking less over-the-counter pain medications, and they're having less interventions with hip joints and joints like that. So overall, in the senior population, it reduces their need to rely on drugs, opioids,
oh, that's
medical
very
doctor
strong.
visits, and all that too. So that's we've seen that section too that has benefited from chiropractic greatly.
And what type of diet, like gluten-free or paleo or the keto diet, are you comfortable talking about?
Well, from my personal experience, I am a gluten-free person because I have celiac disease.
Oh, yeah.
So, and I've had it for 20 years. I've probably had it longer, but I was diagnosed about 20 years ago. So one of the misconceptions about a gluten-free diet, it's a diet to avoid future
Bread, wheat,
problems. And well, there's, with celiac disease, if you don't eat or follow a gluten-free diet, it could lead to intestinal cancer.
Oh, I didn't know that.
So it's not a diet where I'm going to lose, 50 pounds. I think that's a misconception because a lot of people think, oh, well, I'm eating gluten-free, but look at the labels. You're not doing any better if you were eating wheat or gluten-free bread because there's still that carbohydrate, sugar connection. So if you think you're eating healthier, it's not so much about you're just avoiding a gluten sensitivity that may trigger other kind of digestive or allergy symptoms.
I always thought that it just leads to inflammation. I didn't know that leads to cancer.
Well, it does. It does. So inflammation, and that's one of the things that, because you're eating gluten-free, remember that the gluten is gone, but you still have other types of carbohydrates that you're eating. So a lot of the breads are like made from pea protein or tapioca or potato. So that's still a carbohydrate load. And the carbohydrates, when you digest them, they go directly to sugar. So that's probably the most important thing that most people need to get out of their diet or reduce it is sugar. Because sugar is what inflames everything.
And how much exercise do you recommend patients to perform?
It's depending on, their activity level already. I mean, if they're not doing anything, then I tell them at least, to get some movement. Because there is a lot of chiropractors, and remember, we need to keep the spine moving. Movement is life. When you break off that, or restrict that motion, then the life starts to diminish over time.
Sedentary
So
people.
sedentary life is not the best, okay? But even if you're just out walking, half mile, 2 to 3 miles, or get on your treadmill, get on your, elliptical.
Oh, and when did you decide to go from chiropractic care that was normal to the joint chiropractic care in Glenview? Like, when did you start operating in the joint?
So I owned my own practice for 14 years, and then I moved to a private practice, not private practice. I started working for another clinic just north of here. I was a clinic director there for 5 years. And then I just decided that I wanted to, it was just a different, way of looking at things.
And how do you like the traffic in Glenview and the people that come from the North Shore?
Well, the traffic is, as I drive east, it gets a little bit more hectic and all that. But the people here, I think, in the North Shore they're a little bit more active, and lifestyle change that's actually the key, is that they're more lifestyle oriented, where,
Yes.
Some people are just kind of reactive.
Oh, okay.
I won't come in unless it hurts or anything like
okay.
that. But there's quite a few people that, they exercise, they eat right, they make chiropractic part of their lifestyle. And that's really what chiropractic is. Chiropractic is a lifestyle decision.
And what's the advantage of not touching a patient's insurance and doing more of a fee-based or, just having money-based fee versus, compensation of insurances and health insurances? What are the benefits?
I think the immediate benefit for the patient is that especially with the joint, because our fees are lower than any copay or any deductible. So, for instance, my health insurance, I have to pay a $50 copay to even go see the doctor.
Yes.
I have a $6,000 deductible.
Oh, wow. That
All
is
right?
a hefty one.
So our initial visit, as well as our walk-in visit, and any of the packages or even wellness plan that we provide monthly is well below what a deductible would be or a copay.
And do you have any plans for expanding or working more than one office or?
So in the Chicagoland area, the joint has 6 clinics. And we are looking to expand a little bit further west and possibly in the Chicago area and downtown.
And do you have any advice, or will you be working career days for high school or junior high kids? Do you have any tips for future chiropractors or chiropractor assistants? When should a student focus on going to the health sciences, and when should a parent distract them? What is the successful role model?
I think that all depends on the individual. So I have 3 kids, and I don't force them to do anything that they don't want to. And I don't tell them well, you need to take, and follow in your dad's footsteps and become a chiropractor. I just make sure that, they get things done. And if they like various interests, I just push them towards those interests.
Thank you, Dr. Dean Cherniak, for this wonderful conversation about spinal health and the Joint Chiropractic of Glenview.
Thank you for having me.
Thank you for watching Real People, Real Matters with Diana Tulchinsky. Please watch us again.